I am Dr. Rakesh Sahay from Usmania Medical College in Hyderabad, India, and I am very pleased to present on behalf of my co-authors our poster entitled Safety and Efficacy of Lixisenatide versus Sulphonylurea added to basal insulin in Indian patients with type 2 diabetes who fast during Ramadan in the LixiRam randomized control trial. The LixiRam trial was the first trial looking at using a GLP-1 analog lixisenatide in patients during the Ramadan period. In this trial, patients with who were on metformin and other oral anti-diabetic medications with basal insulin were randomized either to continuation of sulphonylurea or addition of lixisenatide in a 1:1 proportion. And we had 150 patients from India who were participating in this study. And if you look at the baseline characteristics of these patients, they were similar in both the groups, with the average duration of diabetes being about more than 5 years duration of close to 5 years duration of diabetes, and who were having a mean HbA1c of 8.5 around at the time of entry into the study, and they were aged around 50 years with equal proportion of males and females. So the proportion of patients with documented severe, if you look at the primary endpoint, which was the development of documented symptomatic hypoglycemia during the Ramadan fast, the prevalence of this was numerically lower in the group that was on lixisenatide plus basal insulin as compared to those who were on sulphonylureas, 1.3 versus 6.8%. However, the odds ratio was 0.02. But if you look at, more importantly, if you look at the patients who developed any hypoglycemia, which is more clinically relevant, if you look at that, we had during the Ramadan fast, we had 1.3% of patients on lixisenatide who had this, as compared to 14.7%. So there was a 93% reduction in the incidence of any hypoglycemia during the Ramadan fast, and this was having an odds ratio of 0.09, with the confidence intervals being in favor of lixisenatide. If you look at the distribution of the hypoglycemic events, we see that during the day, you see that if you look at the period of the Ramadan fast, that is from 4 a.m. to 6 p.m., we see that there was no patient in the lixisenatide group who developed hypoglycemia as compared to a significant number as compared to patients on sulphonylureas who did develop hypoglycemia during this period. The other important aspect was that there was no patient who had severe hypoglycemia in the lixisenatide group, whereas one patient in the sulphonylurea group did have severe hypoglycemia. If you look at the other secondary endpoints, the mean HbA1c decreased from baseline in both the groups by equal number of 0.48%. But this happened with the increase in the dose of basal insulin in both the groups, while the group with lixisenatide required a lower increase in basal insulin, and the mean body weights also decreased in the group that was receiving lixisenatide to a greater extent of 1.8 kilos as compared to 1.4 kgs in the group that was receiving SUs. If you look at the overall safety parameters, there was an incidence of 45.7% of patients with lixisenatide versus 22.8% patients on SU had treatment emergent adverse events, and these were mainly driven by the large incidence of gastrointestinal disturbances which were noted with lixisenatide. But this settled down over the period of time, and if you look at the Ramadan period itself, the Ramadan fasting period, this number was significantly down to 4.3% versus 1.1% in the SU group. No serious adverse events or death were reported in any of the subjects. So in conclusion, the analysis of the Indian population therefore confirms the overall results of the LixiRam study, and has shown that lixisenatide, in addition to basal insulin, is a good option for treatment of patients with type 2 diabetes who elect to fast during Ramadan period.